Yes, babies can get stuck during a delivery, and when it happens, it often leads to either an instrumental delivery or a C-section. So today, we want to help you prevent that your baby gets stuck during your own delivery.
Yes. So in this video, we are going to tell you the 5 reasons why babies can get stuck during a delivery and what you can do to prevent it.
Yes, this is Nathalie, a pregnancy and birth consultant and TCM therapist.
And that's Mathias, a researcher and Science Geek, and we help expecting mummies and their babies naturally and science-based.
Thanks so much for watching this. Let's get started. When it comes to a delivery, the easiest thing would be for your baby to just move from the top of your pelvis to the bottom of it in one and the same position, right? However, for some reason, Mother Nature said, nah, that would be too easy. We are gonna make this more challenging, right? And so Mother Nature added some hurdles to your pelvis to make this more interesting.
Right.
So the problem here is that the entrance to your pelvis has a different shape than the center of your pelvis. And the center of your pelvis has a different shape than the exit of your pelvis, if you will.
Yes, and because of that, your baby has to constantly adjust the position of the head when moving through your pelvis based on where the baby currently lies in your pelvis.
Yeah.
As a result, ideally, your baby should not only be head down when labor starts, but also facing your back, arms close to the body and the chin tucked into their chest.
Yeah.
This would be the ideal position, at least at the beginning of your delivery when labor starts, right?
Yes, when a baby is not in such a position, it can sometimes happen that the baby gets stuck in the pelvis. The good news is that you can normally help your baby get unstuck in such a situation, right? However, a better way, of course, is to bring baby into a better position for labor even before labor starts.
Right.
So please bear with us, because at the end of this video, we are going to refer you to another one of our videos in which we show you how to do that.
Yes. Now, another reason why babies often get stuck during labor is the mother's position. So basically, if you change your position frequently during labor, then you actively support your baby's descent in your pelvis. That's because you constantly change the angle of your pelvis for your baby.
Yes. On the other hand, if you remain in one and the same position during labor, baby may reach a point in the pelvis where it's just not possible to overcome that hurdle, right? So if you want to prevent this from happening, you will have to change your position frequently during labor.
Yes. This leads us to the 3rd reason why babies often get stuck during labor, and that's an epidural.
Yes, epidurals can considerably restrict your ability to freely move around during labor. As a result, women with an epidural often remain in the same position throughout the labor.
Right.
So same problem as we discussed before, right? But the other problem is that they don't feel parts of their body.
Yes, and this makes it very difficult for them to work with their baby. Because if you feel your body, you will normally go into a position that provides you with the greatest comfort. And that position often happens to be the very position which your baby needs to move through your pelvis more easily.
Yeah.
So obviously, if you want to prevent that your baby gets stuck, you would have to find alternative ways of pain relief. But please keep in mind that even if you do have an epidural, it does not automatically mean that your baby will get stuck, okay?
Yeah.
All that we are saying is that there is an increased risk that this could happen.
Yes. Another reason why babies can get stuck is macrosomia. This means that your baby's head is too big for your pelvis. Luckily, this is something that hardly ever happens, right? And even if it does happen, it does not automatically mean that it's game over, because the bones of your baby's head are still soft.
Right.
And because of that, they can still kind of move further together, at least to some degree, so that the head takes less space.
Yes, the only problem is that this takes time.
Yeah.
In other words, your labor will slow down. And that's not necessarily a problem. The problem is that we know several cases when doctors gave women synthetic oxytocin in such cases with the intention to speed up the process. But obviously that didn't help because the baby got stuck, right?
Exactly. We also want to point out that it is very difficult for a doctor to take exact measurements of your baby's head during a routine ultrasound exam. So it's often very hard for them to really determine if your baby's head is going to be too big, unless of course your baby's like super big, right?
Yes. In fact, we really know lots of cases of women who were told that their baby's head is too big for their pelvis, but it turned out it wasn't.
Yeah.
So it's very difficult to come up with a good advice on how to prevent that your baby gets stuck in such a case. Also because you can never know for sure in advance if your baby's head is indeed going to be too big.
Yes, true. The best thing to do is certainly to bring baby into a better position before labor starts, because with the prospect of a big head, this becomes even more important, right?
Yes. And then another reason why baby can get stuck is the shape of your pelvis.
Yes, most women have what is called a gynecoid pelvis shape, which is when you have that Mickey Mouse shaped opening that you can see here, right? However, some women also have a different pelvic shape, which can mean that the baby has less room in certain parts of your pelvis. But of course, there's nothing that you can do about it, right? However, please note that this does not automatically mean that there are going to be complications during your labor. We know women with very funny pelvic shapes and they still had a super fast delivery.
Yes, still in the majority of all cases, the best way to prevent that the baby gets stuck is first of all to frequently change the position during labor. Second, don't make use of an epidural if you can. And third, try to bring baby into a better position for labor.
Yes, this can be while you are in labor, but ideally you do this before labor starts. If you want to know how, have a look at the video that pops up now. You can also find it in the description below this video.
Right. Thanks so much for watching this video. We hope you found it helpful, and if you did, we would be super grateful if you could leave us a like below this video.
Yes, and for more useful tips and tools on pregnancy and baby related topics, make sure to subscribe to our channel and to hit the bell.